everyone, and welcome to May webinar. I'm Councilwoman Dr. Naya Glover on behalf of the Mental Health Advisory Board for Fayetteville, and I'm joined by Ms. Tracy Ricks, who is also a board member. So this month, we're focusing on Mental Health Awareness Month, finding help in Fayetteville. So we want to ensure that you know where to turn and the importance of how soon to reach out for help. So this presentation tonight is layered with a lot of great information as well as resources. So we're going to help you identify the mental health services that works for you, tailored for you, your family, as well as your neighbor right here in Fayetteville. So why tonight's presentation is so important, again, every night for us is important. We are just talking about how busy we are, ensuring that we are showing up for the community and ensuring that we are readily available when you need your assistance. So again, today or this month is Mental Health Awareness Month, and we want to ensure that tonight we focus on single practical questions such as where to find those resources, when something feels off, trusting your gut, aiding your family, yourself, your community at large, parents, partners, as well as neighbors. So where do you turn here in Fayetteville? That is the main goal. So we're going to help you identify available services, how to locate and network with your individual practitioners, as well as organizations, therapists, support groups, as well as the mental health hub. So please make sure that you're taking that opportunity to go to the Mental Health Advisory Board hub that we have created, where all the resources are right there at your fingertips. On that hub, also, we have different types of assessments that you can complete as well, so that you can start getting that baseline of understanding of where you are mentally as well as emotionally. Also, we want to help you feel empowered to act early, make it easier to take a small first step before a moment becomes an actual crisis. The goal for the Mental Health Advisory Board is also to strengthen our community, better outcome for individuals, build stronger families, workplace, as well as neighborhoods. So what we hope you will leave with tonight, a short list of numbers worth saving, a clear picture of how to choose between crises, urgency, a routine care, and at least one next step you can take this week. So better outcomes start earlier. The sooner help arrives, the shorter the symptoms and the lighter the load for you, your family, as well as your community. So Mental Health Awareness Month, again, we're focusing on how we can help you navigate in these areas. Why awareness matters is important too. Of course, we all talk about the stigma that comes about within the community. Awareness is the bridge between silence and support. Mental Health Awareness Month exists because the distance between needing help and asking for it is often built from a single word, stigma. Awareness softens the walls and turns into several questions and barriers that can shape from that one word, stigma. So I should not bother anyone can be some of those thought processes that come about, some of the unhealthy or dysfunctional thoughts that start to plague our mindsets into I know exactly where to call. So those are our goals tonight. When a community talks openly about mental health, three things happens at once. Stigma starts to fade. Signs get noticed sooner, where friends, families, teachers, as well as coworkers learn what to look for and what to say next. Also, help arrives earlier. Earlier care means shorter symptoms, lower costs, and stronger families, workplaces, as well as schools. So resources become visible, of course, right? So when we name what is available, it gets used. A directory such as the Mental Health Hub only helps if neighbors know it actually exists. So we're going to continue to push this hub so that you all know where to get that information from right here in the city of Fayetteville. And always, if you have any questions, you can always reach out directly to us so that we can be further assistance to you. So, the landscape, when we're looking at mental health just as a whole, mental health illness is more common than you think, but recovery is also. When we help one another with early intervention, outcomes become dramatically better. Here's a picture of how the US looks, and I'll talk about later some of the different symptomology, just kind of reminding you of what we're actually seeing right here at home. So, 1 in 5 US adults experience mental health illnesses in a given year. 50% of those who need care do not receive that care that they're actually looking. So, looking at this scale, you're seeing any mental health illnesses, serious mental health illnesses, major depression, and substance use. So, you see that bar for substance use increase dramatically because some individuals, instead of getting assistance in these early intervention to major life challenges, result more to at home coping skills or substance use. So 11 years of average delay between symptoms onset as well as treatment. But the ROI on scale of depression and anxiety treatment shows a dollar amount that if we actually work to help clients or our citizens reach these services in early time periods, we can actually help the impact of how much this actually will affect you, not only mentally, psychologically, but also financially. Ms. Ritz, do you have anything to add on this slide?
No, I think it's very important, like you stated to us, to be aware of the sooner that we get the help, the better, because it's alarming that 1 in 5 individuals, have those issues. And most of the time, either they're not aware of it or aware and just won't get the help. So thank you for, bringing that to our attention.
Absolutely. So, what delays does to you within your home, and we're looking from micro to macro, so from within the home all the way out to community or culture at large, right? Waiting does not make it smaller. It usually make it a little bit more heavier to manage. Most mental health concerns are highly treatable, especially in the first months of actually onset. So as time passes without support, the body, the nervous system starts to respond as well as start to condition to those different challenges. The brain and the nervous system within that network actually starts to become impacted over that period of time. And the people around us also begin to pay a hefty price because they're seeing their family members' mental health decline. So symptoms start to compound. Untreated anxiety often layers depression. You start to first notice sleep problems as well as those physical pains. So stress does lower the immune system, impacts our ability to sleep. It increases probability of heart disease, blood pressure problems, and different other symptomologies. Emergency rooms becomes the default. People will typically go to the emergency rooms when they're in mental health crises, and then they navigate through different facilities from there. But what we're trying to promote here is that if you notice those challenges ahead, you can reach out to a mental health practitioner or clinician. Again, all on our mental health hub, where you can go there to find some that are working right here in your community. Work and family and financial strains have been linked to mental health challenges, and also just focusing on the understanding that you can heal or recover from some of the challenges that you may experience. So, again, the earlier you reach out, the smaller that mountain will be able to defeat, right? So, broader than you think when we're looking at mental health is not just a diagnosis, it is everyday living. You do not need to label your challenges as good or bad, difficult, or something of that nature. We want you to be able to deal with them head on with a true understanding of what is actually being experienced in your everyday life. So, any of these experiences below is enough to start a conversation. If you're going through stress, right, that pressure that is going on daily. So we see the daily stressors that kind of chip away at us. different things that is in our everyday life that we kind of ignore. We brush under the rug and they become that mountain that I previously highlighted. It builds in anxiety, depression, where anxiety start experiencing those racy thoughts or restlessness, panic, or starting to think what if. And that's how that unhealthy thought process starts to begin, and it becomes a repeated cycle in your actual life. Your nervous system is now responding to this, and it's becoming, again, conditioned, familiar with this fight flight response that is going on, shifting into depression. And oftentimes these two correlate, right? When I'm looking at anxiety with a client, I'm looking at current day and into the future, things that they may feel out of control of, things that they the unknown. So when we're looking at anxiety, we're definitely looking at those things that you're just feeling out of control of that particular time period, right? Depression is that rumination, looking behind us, things that have not been resolved in our past that can cause low energy, loss of joy, that feeling of stuckness, withdrawal from family are also warning signs. And again, on the Mental Health Hub, we have these two um, assessments that you can complete yourself to get a baseline. Again, it's not to diagnose you, but give you an understanding of, are you at that point of early reach out, right? Grief and loss, also death of a loved one, divorce, marriage, all falls up under grief and loss, and identity changes. Sleep problems such as insomnia, also nightmares, oversleeping, just the overall feeling of exhaustion that you just cannot bounce back from. Even if you're getting that full body rest or that 8 hours of sleep that is often promoted, but you're still waking up tired, then there could be something that lies under the surface of what's going on that we can actually explore. Substance use is typically one of the catalysts that pushes you into therapy. However, we want to reach you prior to relying on this self-medication tool, right? So alcoholism, prescription drugs, vaping, nicotine, all kind of fall under this particular um, warning sign. Workplace burnout, household burnout, those are different types of things that we also can explore when we're working with clients. Cynicism, depletion, kind of going through the motions at work, and you're starting to feel like you're on a repeated cycle where you're not having that opportunity to enjoy your life outside of work. Relationship strains also can be challenging, conflict in the home, parenting overwhelmness, isolation, as well as loneliness. What we're seeing as we conduct a lot of our surveys, and many of you that receive the text message of tonight's webinar may have had a link in there that's saying survey. So we're promoting that you all complete that survey as we continue to work on collecting data right here in the city so that we can see the symptomology that may be on the rise or peaking right here in our city. So what we're seeing again are peaks of anxiety, depression, as well as loneliness, right? So we're working on different types of workshops as we continue to promote different types of um, things right here in the city, workshops again, different types of events in the city. Please feel free to come out so that you can speak with some of us and get some different types of guidance if you're challenged in any of these areas. Ms. Ritz, any add on to this slide?
No, it's great information. Thank you again.
You're more than welcome. So, what typically holds people back from reaching out early? If you have been hesitated to reach out, I typically hear clients say, it's difficult to talk to a stranger, right? Sometimes that's the best guidance. Or I've done this before and it didn't quite work. So sometimes you have to find that therapist that's tailored to you, that fits you, and trying it out one more time may be that great outcome that you're looking for. Being open and honest with your therapist is vital as well, so that you're not feeling that you're alone in these different challenging times. So some barriers below are real situations that we encounter, some of the thought processes and things of that nature that kind of goes through an individual's mind that prevents them from actually coming into therapy, such as I do not know where to start. That's why we're here. The cost, the insurance. We can direct you to some therapists that may have a sliding scale. Just the stigma. You don't want people to know what you're going through. Am I is this situation bad enough to actually reach out to a therapist? And the challenge for a lot of us today would be that time, the scheduling of it. There's a lot of therapists that works on the weekends to accommodate that, or late nights as well to accommodate your schedule. So anything that you're thinking of, we're working to ensure that your needs are actually met right here in the community, right? And then again, just like I highlighted, the previously bad experience of working with a therapist. However, again, we can help you find that individual that's tailored to you, that meets or understand your actual needs. As we continue to move forward tonight, Ms. Ricks will take over in the next 3 slides, where she'll start talking about some of the insurance, the sliding scales, some free crisis lines that you can actually reach out to, and just understanding that need threshold, right? Understanding your gut when you need assistance, ensuring that you're activating on reaching out to that person. So you do not need a big enough reason to reach out. If your gut says something is off, then trust your instincts, right? We have these monthly webinars, we have the monthly events that we're doing. So we're trying to ensure that those early signs are worth hearing and worth actually assisting in. So some additional signs would be persistent low mood. And typically, a good rule of thumb is if any of these actually, let's say 2 or more, last more than 2 weeks, then that is a great reason to start to reach out. Sleep changes, insomnia, oversleeping, where you're having some wakefulness as well, still waking up exhausted, but you can tell that your brain is just not turning off. So, a lot of things I tell my clients when they're having sleep challenges, I assess, their sleep hygiene. Are they taking in too much social media right before bed? Of course, you need to give your brain at least 1 hour before you shut off your for tonight, or cut off for the night, because your brain needs time to relax as well. So taking time 1 hour before bed to stop engaging in high content or emotional content. Withdrawing from people, um, canceling on friends and family more than usual can be some signs. Again, those racing thoughts that are going through, heightened irritability and anger, where you're becoming just a little bit more snappy in your friend circle or to families. Some of that displaced aggression, if it's overwhelming in the workplace, kind of identifying where that challenge is coming from, and if there's some displaced aggression when you go into the home or vice versa, right? We work on those things. And just overall, just loss of joy, just not that inability to engage in things of interest anymore. So many doors is open here, right here in your city. One city, Fayetteville, we're working on it, right? You are at the epicenter of our focus for the Mental Health Advisory Board. You have more than just one option here that most cities your size does not kind of highlight. So we want to make sure that you know these different areas, right? So here we'll continue as we move forward with Ms. Rich. She's going to tap into all of these areas here of how you can actually start to navigate. Every connection on the right is reachable within 5 minutes. All right, Ms. Rich, you can take over.
Thank you.
You're more than welcome.
There are 3 levels of help. Choose the one that matches the most. Not every hard day needs an ambulance. Not every emergency can wait until Monday. Here is a simple way that we can decide. First, let's talk about life or safety at risk, the right now crisis. Thoughts of suicide or harming someone, severe psychiatric break, overdose, no safety at home. So you can dial 988, call or text, and that's 24/7. Also, 1 800 715 4225 is a dispatch for the mobile crisis. 911 and say CIT is the trained officer. They have trained people there when you dial 911. And also Piedmont Fayette, and they take walk-ins, okay? So you guys don't be afraid that if you know that you're, in a situation where, okay, I'm having these suicidal thoughts and I cannot, get rid of them. Or you're thinking about harming yourself. I've talked to several clients recently who said that they had those thoughts about harming their babies. They were going through postpartum. And so there are resources, you guys. Take advantage of them. Write these numbers down, screenshot the information. Also, within days, urgent. That's the second category. I cannot wait 2 weeks. Remember that, okay? This is concerning new severe symptoms, maybe a recent loss. And once again, I just mentioned about the postpartum changes. That's been very prevalent, you guys, amongst a lot of women. So, don't be afraid to reach out and saying, it's going to pass over. Also, sudden substance escalation, or perhaps you cannot function at work. So you know that there's something going on. Do not wait past those 2 weeks, okay? So as soon as you see these symptoms, first, you can walk in a clinic, okay? They have same day routing. Then you got GCAL, which is the same day phone triage. Well, I call it an acronym, but you guys see it there. And then you have your PCP, and they can give you those same week appointments. Same week, okay? So you don't have to wait. And then also EAP, 3 to 8 free sessions. They're often within, the first 48 hours, often within 48 hours. So these are resources that you can take advantage of. Most urgent appointments happen within 1 week. So if you know you're going through these situations, do not, you know, just say it's going to pass away. And let me talk to my Christian and my believers out there, because I am a licensed Christian therapist. Don't say, oh, I'm just going to pray it away. We believe in prayer, but seeking help, okay? Someone who's professional, that's not saying that you don't trust God. I want to make sure that that is clear, okay? Also, the third category is ongoing routine, lasting support and growth. Weekly therapy. I believe in weekly therapy sessions, you guys. Also, medication management. I know there are so many people who do not believe in meds. There are a lot of people who don't want to take their meds, but know that there is help for medication management. There's nothing wrong with that, okay? Also, peer groups. I am a groupie. I believe in group therapy. Oh my goodness. And if you've never experienced it before, just reach out. You will be surprised at the connections that's, so vital for our healing through group therapy. Also, family work, okay? And then long-term recovery. Also, I want to reiterate that even when you go in for therapy, having that family time, even family therapy sessions can make a tremendous difference in how your family can heal together. Also, sliding scale providers, excuse me, guys, the Mental Health Advisory Board, our hub directory, okay? So there are sliding scale providers. We are out here. And then we have our private therapists, and Medicare, excuse me, are ways that you can go if you have those type of insurance. Or private insurance is also available. And I didn't know all of the insurance they have out here now. You guys check with your job. So many companies are aware of mental health, issues that's holding people back and making people, not able to do their jobs. Please, you guys, look into it. And if your company is not offering it, maybe you can talk to them about, getting into the know. Tell them, hey, you need to come up to par, up into the 2000s, because now it's very, very, prevalent that people need this type of help just to make it to work every day. And then we have NAMI of Henry County and Fayette County. They have free peer groups, and I know someone who's very active with them, and she shared with me they have a plethora of of groups that they provide. And also the Mental Health Advisory Board, our hub, we have full provider directory, and Dr. Glover has done an amazing job, you guys, with that hub. And those who need that help, please take advantage of these resources, because we are one of the few cities that I have seen that provide these type of resources. So most start within a 15-minute phone screening. Okay, within a 15-minute phone screening, you could be connected just that quick and get the help that you need. Let's go to the next slide. Also, okay, when the moment is now, I want you to save these to your phone tonight. Y'all know how we always say dial 911? Okay, dial 988. And I aged myself. Somebody said, what is a dial? Okay, press 988. Back in my day, we say dial it up. But no, press 988. Hey, save it on your phone, speed dial. When the moment is now, these 6 lines cover almost every crisis you can name. Maybe for you, it might be a neighbor, could be a kid, a parent, or a coworker. So y'all save it, screenshot it, okay? So 988 Suicide and Crisis Lifeline. Call or text, and it's 24/7. And it's also confidential. And then we have Georgia Crisis and Access Line. I said GCAL, y'all. I gave it a nickname, okay? That's the acronym. It's the dispatch mobile crisis to your location. And they have an app. And that's 1-800-715-4225. And then also, you guys remember 911, still available. But if it's for suicide, I want you to remember 988, okay? If it's a suicide and crisis. But 911, you can request a CIT, a trained officer, okay? Which is crisis intervention team officers. They're trained, y'all, in mental health response. Remember that. Also, Piedmont Fayette Hospital, their emergency department. And that's at 1255 Highway 54 West. And that's emergency psychiatric. They have people on call, you guys. They have psychiatrists that's on call. And that number is 770-719-7000. And then we have our veterans and first responders. Okay, along with that 988, press 1. And it's called Cop Line, 1-800-267-5463. And then we have the fire and emergency services, 1-888-731-FIRE. So 988 plus 1. Don't forget that. And then we also have our SAMHSA National Helpline. And also they have 24/7 treatment referrals. So that's findtreatment.gov. Okay, you guys? So don't forget about those. And then also where Fayetteville, for the days after the first phone call, where Fayetteville builds lasting support. Mental health is a practice, not a moment, you all. Each of these is here to walk alongside you for weeks, months, or years. And I truly believe that, for me, it will be an ongoing, forever, lifetime transformation for me, because I see how important it is to have people to walk alongside of us. Okay. So, City of Fayetteville Mental Health Hub, there's a provider directory, free directory of local therapists. Okay. Sliding scale options, groups, and events. Also, recovery community groups like AA, Al-Anon, Smart Recovery, free local meetings. And so we have the information on how to connect with them. And then we also have NAMI, Henry and Fayette counties, free. Listen again, free for those who saying I can't afford therapy, I don't have insurance. NAMI have free peer support groups, family education, and helplines that's available. Also, we have 211 Georgia United Way concerning your food, housing, utility assistance, social services, and it's also 24/7, you guys. Then we have, once again, City of Fayetteville, HR, EAP referrals for city employees, confidential employer paid counseling, usually 3 to 8 sessions free. And then we have our specialty line for those of you guys who are dealing with postpartum. 1-800-944-4773. Trevor for our LGBTQ community and youth. 1-866-488-7386. And then that physical support line is 1-888-409-0141. Also, insurance, if you're unsure, call 211 or browse the Mental Health Advisory Board Hub. And they can screen you and connect you to a sliding scale option. So no more excuses, you guys. Let's keep going. Remember, within that first 90 days, it is a conversation, not a couch, not a test. Most people who most people who hesitate to seek therapy say they do not know what happens after the first phone call. Here is the honest version, okay? Common approaches that you may hear: CBT, which is cognitive behavior therapy. Then we have EMDR. In our company, we specialize in a lot of the EMDR where I am. And so we have a lot of places out here now for those of you guys who have heard about it and you want to know more about how to, pull up some of that childhood trauma. We have EMDR available. There are, people who are also equipped and professional therapists for DBT, emotional skills. Also, we have ACT, acceptance and commitment therapy, and then family and couples therapy. And then one of my favorite, again, is group and peer support. Also, medication management with a professional, okay? Psychiatrist. We got our psychs and NPs. So please, you guys, take advantage. A good therapist will explain which approach, fits your goal or refer you elsewhere. And notice the cost, okay? Reality. We have, once again, sliding scale therapists are available right here in Fayetteville. Sessions can be as low as a few dollars. Finding them through our mental health advisory board is also, hub. I'm thinking about our board now. But we have a great board too, you guys, with therapists there. But find them through our mental health advisory board hub. Also, once again, Medicaid and Medicare. Most private insurance covers outpatient therapy, you guys. You just have to check with your company. Also, EAP. Many employers cover the first 3 to 8 sessions free. And I found with a lot of our clients, this insurance coverage can last for months, you guys. I've had clients, I'm like, listen, it's time for you to graduate. They're like, I don't want to go. So, it's important also, as Dr. Glover mentioned earlier, having the right fit for you as a therapist. So have that first conversation. And if you're not comfortable, don't be afraid to say, this is not a good fit, and keep searching until you find the right one. Okay, next slide. And I didn't even ask you, Dr. Glover, did you have anything to say? I'm just going on.
No, you're doing amazing. You can keep going.
All right. Okay. Sorry about that.
No, you're
also, healing in many languages. Therapy, is not the only door. Your tradition holds wisdom too. Whether you pray, meditate, or sit in silence, there is a pathway that respects what you already trust. Often the strongest plans combine more than one. And here is one of the ones that I want to talk to my believers, that pastoral counseling. Many churches in Fayetteville, in Fayette County, offer free pastoral care and connect to licensed counselors. So once again, if your pastor is not a licensed counselor, get what you need from them, okay? And then also don't feel like you are committing the ultimate sin if you look for a licensed counselor who specializes in whatever your issues are. And I will say this, if you are a believer, I would advise that if you can find somebody that goes along with your beliefs, okay? Also, they're faith-led. And then we have our peer support, NAMI connections groups. People who have walked the same road, right? Completely free with no diagnosis required, and it's peer-led. And once again, you guys, groups are amazing. I can't stress enough how, if you want to start somewhere, if nothing else, hey, let me go to a group and see how it's going to go. Some people are afraid of individuals starting out. Don't be afraid. But if you just need to start somewhere, this is a free resource, NAMI connection groups. And then once again, a lot of therapy is including group sessions now, So where I am, we do individual and groups. So don't be afraid of the groups. Just please don't. It's so much happening in groups. I'm telling you guys. Also, family-centered care. Family therapy and parent coaching for couples. But when I can't stress this enough, I see so many married couples, if they just had someone to mediate, to just help them with a greater understanding, a professional, not your mama and not your cousin and not, your best friends who are not professionals, but someone who is qualified to help you navigate those rough years of marriage. Or maybe you're, want to become married and you guys are stressing each other out. Go for premarital counseling. And then parents of teens, I had someone that texted me today and I'm like, oh my God, they're going through a divorce. And her son, not a client, but someone I know, and oh, he's going through the stage of he's mad with the mom for divorcing the dad and cursing the mom out. And she's stressing out. I'm like, look, seek therapy, go and get help. So we have parents of teens who need that help, and multi-generational homes, because now parents are living older. And I was one of those caregivers for a while. So that can be a very stressful, time for children who are living with grandma and now great grandmas. I know a young lady and she's young to me. She's in her 70s and she's taking care of her great grandchild. I'm like, wow, So we're in a time frame now where people are living longer, and that can create chaos, and especially if there's generational cycles that's being repeated. I talked about that in group today. Mommy did something and grandma repeating it, and now the children are, a product of some dysfunctional things that's been passed along. So family-centered care is important as well. Also, culturally grounded providers. Many Fayetteville therapists specialize, come on my people, in Black mental health, also our LGBTQ community and care, and immigrant family experience. So you guys do not be afraid to reach out. Also, healing happens in many languages: clinical, command, spiritual, and ancestral. Pick the one that meets you where you are, then build from there. So remember, just start somewhere. And I'm begging you guys, start somewhere, okay? Also, you do not have to fix it. You just have to stay close, Stay close. 4 moves that bridge someone you love to the help they need without lecturing. Oh, I talked about that earlier today too. We don't have to keep lecturing people. You need help. I was talking to a client and her daughter is just taking her over the edge. You're crazy. Don't do that to your people. Please don't do that, you guys. So without lecturing, without trying to fix it, especially when you're not professional, because a lot of times you think you're fixing it and it could be making the situation worse, or panicking. When you see maybe someone in your family or someone you're close to and they're, acting off, and that, don't panic, okay? We're going to talk first about notice. Notice when they're withdrawn. Maybe you have someone that usually they're usually talkative, right? And then all of a sudden they don't want to come around anybody, and you notice that they're, more solid now. That could be a sign. They're irritable. Somebody said, I'm always irritable. That could be a sign you need to come see a professional therapist. Drinking more. I was thinking about how I know back in my day, everybody thought drinking was just a common thing to do, drown your sorrows in your favorite glass of wine. But if you're having to need a glass of wine every night, 2 or 3 or 4, just to, calm down, that might be a sign that you need help. Also, sleeping less. You just can't get that proper rest and you feel off. When you're feeling off, and I always share with clients, when you start feeling some kind of way, you're like, I'm feeling some kind of way. And just like that caution light comes on in our car, our bodies will let us know. And once again, trust your gut, trust it. This caution sign is for a reason. That caution light is coming on to let you know that that car needs some help. And even with our cars, if you wait and wait and wait, what usually happens? There's a breakdown. So before every breakdown, there's always warning signs, okay? So you guys notice these things. Also name it. I have noticed you seem really tired lately. And then ask, how are you actually doing? And especially with our youth, don't be the type of parent that you're just so busy and caught up into your own things that it's hard for you to even pay attention to your children, And of course, with grown people as well, ask your boo, are you okay? I notice you've been tired lately. How are you actually doing? And then listen. Do not problem solve. Repeat after me. Do not problem solve. Do not compare. Well, you know what? My friend's daughter, she's always talking to her mother. Don't do that, okay? Reflect back, okay? Reflect back and maybe saying, that sounds really heavy. That sounds heavy. Maybe you should seek some help. And then bridge. And maybe saying, like, asking, like, do you want me to sit with you while you call 988? Or look at the Mental Health Advisory Board Hub directory together. Sit there with them so that they can feel more comfortable. And I know for me, before I started healing, it makes it more pleasant. I'll put it that way. When you have an uncomfortable situation and someone holds your hand. So also, don't forget, here are phrases that open the door. Maybe you can say something like this. You do not have to have it figured out. I'm just here. And I do that a lot. I do it a lot because I know how hard it is to reach out for help. And maybe you might be the type of person that you don't want people to know that you're going through something. So be that vessel for someone else to get the help they need. And maybe once again, you can say things like, you don't have to have it figured out. I am just here. Or perhaps you can say, I would rather ask you and be wrong than not ask. Okay. I would rather ask you and be wrong than not ask. And even I'm trained for suicide prevention. And one of the things they say about a lot of people who even commit suicide is someone just asks them, okay, are you okay? Is everything all right? Also, what would help most right now? Ask. Would it be a ride, a meal, or just company? Sometimes people just need someone to talk to so they can start the process. And no, I want you guys to note this. Note this, okay? This is not weakness. This is the part of being human nobody talks about. And I know in our culture, let me slow down, especially for my age group now. I know 45 and up. We came from that generation of, I'm going to give you something to cry about, or, you just having a bad moment. Or once again, for my believers, you just need to pray a little bit more. How many of you guys have heard those type of things? So if someone says they want to die, stay with them and call 988. Okay? Remember, stay with them and call 988. You can ask directly. Research shows asking does not increase risk. Once again, I have been taught through training, professional training, that most of the time we just don't ask the question. Okay? So let's keep going. All right. Awareness is the doorway. One small step. Action is the threshold. Choose one, just one, before you go to bed tonight. Small, repeated steps change physiology, families, and entire communities, okay? Small steps. Y'all remember this, okay? Now, tonight, just 5 minutes, save the numbers. What? At 988 and 1-800-715-4225. Add it to your phone right now. Pull your phone out and just add it there. Label them Helpline. Add it to your favorite list, and you will not have time to think when it matters. So a lot of times you're not thinking. You get into that flight or flight syndrome, and when you're feeling overwhelmed. And then I want you this week, matter of fact, just do this right now as well. You have your phone out, bookmark our Mental Health Advisory Board Hub. Just bookmark it, okay? Visit Fayetteville, Georgia, that's the abbreviation, .gov/Mental Health Advisory Board, okay? And the full provider director of Fayette Village. I'm sorry, you guys. And you see the Mental Health Hub.org and share the link with at least one person. Y'all, we have so many great resources. So share it with somebody. And then this month, make the first call. Now, I'm not going to even tell you to wait the first month. I'm going to pressure you tonight. Go ahead. Make the first call. You can make it within the next 48 hours, okay? If you have been thinking about it, call GCAL at 715-4225 or browse the Mental Health Advisory Board Hub directory. Tell them it is a first step. They have heard it 1,000 times. That is their job. So don't feel like I'm bothering anybody and that, something's wrong with me for seeking help. And once again, seeking help is not a sign of weakness, it's actually a sign of strength. And our next webinar is going to be Tuesday, June 30th at 6 o'clock p.m. So I'm going to let Dr. Glover take it from here, I think. And I just want you guys to know that awareness is the key. And I always share it this way. And I tell anybody who will listen to me, the first step to any type of recovery is awareness, and then become intentional about seeking the help that I need. Okay. So we want to remember these two words: become aware and then intentional about growth, about healing, and about changes. And stop worrying about what other people think. A lot of times people have, wanted and needed help, but they were afraid of what their family members are going to say. And I will say it this way: it's really none of their business what you're doing. Just like when you go see your doctor, you having whatever issues you're having. Do you discuss with everybody in your family that I'm going to the doctor because I have migraine headaches? No, what? You make your appointment. So same thing with our mental health, make the appointment, make that first call, reach out and receive the help you need. And then you can thank us for this information later.
Thank you, Ms. Ricks, so much. I want to take a pause right now to see, does anyone in the comments, Ms. Ricks, can you see in your comments if anyone have any questions?
Okay, I'll check it.
Or any feedback or anything that they may need from the Mental Health Board.
Okay, I didn't see anything in the chat just yet, but if you guys have any questions, feel free to, type them in the chat. Or if you want to ask a question, can they raise their hand, I guess, or speak out? Okay.
Okay, thank you so much, Ms. Ritz, for all your great information and always partnering with me on here. So as we come to a close, again, please place any comments or questions in the chat box. Thank you all for always joining us monthly. Remember that you're not alone here in Fayetteville. We want to ensure that whatever your traditions are, how you pray, meditate, and how Ms. Ritz highlighted, even if it's sitting in silence, we want you to know that we are also here for you. So we've given you a lot of great resources tonight that we want you to share, but also sharing with friends, family, loved ones are very important. To ensure that we continue to build a healthy, mental health, wellness, physically well community as well. All right. So again, thank you so much for joining us, for showing up, for listening, for caring enough about your city to learn where to actually turn. We're always here for you. And you can always reach me directly at nglover@fayetteville-ga.gov if you need any assistance, direction, or just need to be linked to someone that can actually assist. Ms. Ritz, do you have anything for closing?
I just wanted to thank you, Dr. Glover, for your vision once again. And I know that it is so vital, to have the resources available at our exposure, just that something that we don't have to just dig through to find out the information. Because once again, according to research, most people, when they're going through those situations, the last thing they have the energy to do or feel like doing is trying to search out, how to get help. And you've made it so simple for us. And also, I want to thank you for providing these webinars, because even tonight, as long as I've been, a therapist and working with mental health, it even reiterated to me the importance of stressing to people around me, get the help, seek the help, and we're having this, of course, Mental Health Awareness Month now, but every month to me should be mental health awareness, because it's so vital. Once again, 1 out of 5 people have those mental health issues that they're either not aware of or aware of and just not willing to do anything about it. And I always tell my clients, we're the 1%ers. So for those of y'all who are on here tonight, let me tell you who are the 1%ers. 1% of people that I personally know who's willing to do something about our mental health, who's not just talking about it, but we decide to be about it. So thank you, Dr. Glover, and thank you guys for joining us.
Thank you all so much. We do have a mental health event that's coming up. It was scheduled for this Saturday. However, we are rescheduling due to a rain, of course, rain event. So we're looking at future dates, currently potentially June 14th. So stay um, informed, looking at on the Facebook page, the city's Facebook page, for any updates for our May event. We was going to do the May walk, the mental health walk on this Saturday, but of course, rain is coming through. So we are looking to actually reschedule that one. So if you have any questions or want to be a vendor or just want any updates on that event, again, please reach out to me directly at nglover@fayetteville-ga.gov. Thank you all and have a great night.
Bye bye.